Well, welcome everyone. I'm Heather Krasna, Assistant Dean of Career Services at Columbia University's Mailman School of Public Health. And I'm just thrilled to see so many people participating today in this webinar, which is Hot Jobs in Public Health. We're really grateful to be hosted and have this presentation organized by the Association of Schools and Programs Public Health. And we have a really exciting program available for you today. We will be talking about careers in public health and sharing some specific opportunities that are available right now. And then we'll have some time for questions and answers. So go get your questions ready. And those questions we'll be answering at the end of the webinar. So feel free to put your questions in the chat and we'll get to those. And also as a note, this webinar will be recorded so you can access it after the event. So today's session, I am very excited to have 4 fantastic panelists joining me. I'll be starting out and giving an overview about careers in public health. And then we will have Lindsay Johnson from the brand new Public Health Americorps. You can wave if you want, Lindsay. Then we will have Dr. Christine Bean from the Association of Public Health Laboratories. And then Joanne Pearsall from the Association of State and Territorial Health Officials, ASTHO. And finally, Dr. Wences Arvelo from the Centers for Disease Control and Prevention Epidemic Intelligence Service. So I'm going to kick it off and talk all about careers in public health. And I'm going to start with this picture, the lifelong job, the constant protection of their health. This is a picture from, I think, the 1930s from Chicago. And I like to look at this because to me, it a little bit encapsulates the idea that public health is a life's work. And it really is so incredibly important, especially right now, especially because of everything that's happened in the last couple of years. So today we're going to talk about public health, who actually offers public health services, and we'll talk a little bit, just a snapshot of some of the more than 101 different careers in public health. And we'll talk about different career opportunities and pathways and exploring resources and some loan repayment programs. And then we'll talk a little bit about how new public health grads and other grads can enter into the public health workforce through different fellowship programs and also converting into permanent positions. So I'm guessing that most people in this audience know what public health is all about, since this program is being hosted by ASPPH. So I'm not going to go into too much detail about the many different aspects of public health, but these are just a couple definitions. What do we mean by public health? We're talking about the science of protecting and improving the health of people and their communities. We know about prevention, protection, and promotion. Prevention of illness, protection from risk, promotion of healthy lifestyles and behaviors. And another definition, the radical idea that each and every individual person has the right to be healthy. Another way to think of public health is we know about physicians or nurses who might provide medical treatment to an individual person once they're already sick. We can think of public health as sort of like that physician, except that the patient is an entire community, a population, a state, a country, even internationally. So this is just another way to frame it and to think of public health as keeping you healthy and preventing people from getting sick. This slide you might have seen before. This is an image of some of the foundational public health services. And you can see we're looking at public health infrastructure, including all the things that go on behind the scenes to make sure our public health systems work. And then some of the content areas. We have infectious disease, chronic disease prevention, environmental health, maternal child health, family health, and access to care and so forth. So these are just kind of a quick overview of what are we talking about with public health. And now you might be wondering, well, who's doing all this public health work? And today we're going to focus on mostly government, which I think of as the backbone of public health. But public health is definitely broad. Of course, we know some of our favorite federal agencies that deliver a lot of the public health work, either research or guidance and regulatory issues and so on. It goes on and on. We, of course, think of the CDC and US Department of Health and Human Services. There's other departments of Health and Human Services and other agencies outside of Health and Human Services that do a lot of public health work, like the Peace Corps, USAID that does global health work, you have the EPA, and then you have state and territorial health departments. And one of our speakers is representing the Association of State and Territorial Health Officials, so they can talk about public health as it's delivered by state governments and territorial governments. Then we also have local health departments, and that's really a huge amount of the public health work that gets delivered. And that includes cities, counties, and sovereign tribal nations also that have their own health departments. We have public health delivered through hospitals, health systems, some of which includes research, but also other kinds of interventions and programs around public health. We have global public health with NGOs and humanitarian action. We have nonprofit organizations, community-based organizations. A huge amount of work is done by nonprofits. And then we have the private sector. So we have government contractors, consulting companies, marketing companies, technology startups, and medical device and pharmaceutical companies, all of which are contributing to public health. So thinking now of where we have an idea of where you might find a public health job. What are some of the actual jobs you can get in public health? And you can see there's really a diverse range of different careers in public health, some of which are fairly unique to public health itself. And you can see these are arranged somewhat in order of, how much education or training would you need for each of these different kinds of career paths. You have some which you can get on the job training, and you could enter with a high school diploma or a community college degree or higher. And then others that you may be able to do with an undergraduate degree, a public health degree, or a range of other bachelor's degrees. And then there are certainly many in public health which require either a master's degree, especially a Master of Public Health or other related degrees, or potentially a doctoral degree such as a PhD or a DRPH, or more clinical degrees like an MD, public health dentistry, public health pharmacy, it goes on and on. And there's also jobs for other majors, not necessarily only public health degrees. So we also need to bolster our public health workforce when it comes to the operations and HR and behind the scenes, IT, data, informatics, engineers, actually, counselors and social workers, it goes on and on. So I'm going to take a few seconds and just spotlight a couple of jobs in public health. Many of you may have heard about these different public health jobs, and I'm kind of highlighting a few people that were included in a book that I co-authored called 101 Plus Careers in Public Health, the third edition. So of course, many of us in public health have heard of an epidemiologist. I know that the general public probably still doesn't necessarily know what an epidemiologist does, but I think of an epidemiologist as a disease detective looking at patterns of information and data to see how diseases are spread. How do you potentially use that data to make public health interventions work? There's a lot of statistical analysis, a lot of community outreach and engagement. Caitlin Wolf, who we interviewed for the book, also does some field epidemiology, which is not just the coding in SAS or the other technologies that you might use, but also going out into communities and looking at where there might be a disease outbreak or hotspot. Another public health career, a different one, health educator. There are a lot of needs for people with a degree in public health or training in public health who have the skills to design and implement health education programs. And here's an example of someone who is doing perinatal education with a goal of reducing disparities and improving health equity in maternal child health. And the person we interviewed, William Moore, actually is a doula as well as a health educator. So really an amazing kind of career path for someone who really likes building programs and working with people. Another incredibly important career in public health is community engagement. As everyone knows and has seen from the COVID-19 pandemic, there's huge problems with health inequities. And there's also a huge focus now in all of public health. The 10 essential services of public health have all been reframed so that health equity is at the center. So we have to ensure that the communities that we're working with in public health are leading the efforts, that they're there at the table and we're collaborating side by side with community members. So an example of this type of career, which is part of health equity, is a community engagement specialist, and there's sort of a range of job titles that have to do with this. Another one that you may not have thought of is environmental health inspection and sanitarian. This is kind of one of the, I would say, one of the oldest public health careers. It goes back at least 100 years. And those of you that are kind of hands-on and also like maybe the sciences, the biological sciences, might find this to be really a rewarding career. And so as an example, these are folks who might go out and make sure that a restaurant is providing safe food preparation, or inspecting a daycare center and making sure that it's being managed in a way that's healthy for the kids. So this is a really another field career that is really unique to public health, and something that you can look into. Another example is sort of program management, and this is just one example of HIV prevention as a program. So we interviewed someone who is a HIV program strategist, designing programs to prevent HIV, working on ending the HIV epidemic in the United States. And you can see that there's so many things you can do in this type of role. There's a huge need, again, for program management, program coordination, program planning and evaluation. And so this is just an example of working with different stakeholders, people in various communities, to get them engaged and then to design interventions that really work. There's also the other end of this, which is the program evaluation. So assessing whether a program actually was implemented correctly. And so one of the people that was included in the book also is a program evaluation specialist working with a tribal health department in Oklahoma, to assess whether the program is implemented correctly, whether it's working for the people that it's meant to serve. And then just one more spotlight of a public health career is emergency preparedness. And so there's obviously a huge need for people with this kind of training who have a public health perspective and who understand how to prepare for emergencies, how to ensure logistics work, how to train people in a range of different settings. And so again, one of the people that we interviewed is also in charge of emergency management for New York City Health and Hospitals Corporation. She sent me this picture, which is when she was training people to safely, this is a little bit sad, this is really sad, but she was training people to safely move people who had died from COVID during the big outbreak in New York City that happened in March of 2020. So even workplace safety is part of this. So she's working in a huge health, one of the largest health systems in the country, to provide emergency preparedness for them. So you can see there's just a huge range of fields and careers that you can get into. So how do you choose? How do you figure out what public health career makes sense for you? So first and foremost, if you are a public health student or any college student, to be honest, my first recommendation is go and talk to your college career services office. You know, most colleges and universities do have career counselors or career services office that can work with you and help you figure out what makes sense for you and what skills you're most interested in using and what mission you care about the most and all of these things. There's also a career assessment that you can take, and it's listed right here on the website. This is a simple, free 10-minute career assessment, and it will help you figure out what your career interests are. And you could see there's sort of kind of themes or groups of career interests. Most people have their top 3. And so of these 6 different interests, you'll see hands-on realistic jobs where you are working with physical objects and so forth. There's investigative jobs where you're doing research or scientific evaluation, things of that nature, finding data and information and making meaning of it. The artistic careers, which are more about expressing yourself. There's writing and communication in there. Social, which is the helping professions, the kind of people professions where you're helping others, working with communities, counselors and social workers are in there. You have enterprising, which is the leadership and management and sort of more business fields in public health and in other areas. And then conventional, which is more about making sure that everything is accurate and that we follow rules and regulations. So you can actually see, just as some examples, if you take this assessment, it'll allow you to kind of explore these different careers. And so you can see there's some public health occupations that are the very hands-on, such as lab technician, food inspection, consumer safety, and you can see the letters that, you know, each of these occupations has up to 3 letters. So this lab technician, for instance, is realistic, investigative, and then conventional. There are a ton of public health careers that are investigative. So if you like research and science and finding meaning from information, then there's a lot of careers in public health for you. Some of these require more years of education, at least a master's degree. Some require a PhD, some don't. But you can see a lot of the sciences, research, epidemiology is in there. There's just a whole range of interesting positions. Artistic, you'll see there are at least a couple of jobs that are primarily artistic, but when you look through the other occupations, you'll see that that letter A, artistic, shows up in a number of other occupations. So there's a lot in communications, writing, grant writing, and so forth. And then we have our social occupations. There's actually a ton of public health careers where you are helping others, where you're talking to people. These I think of as the caring and counseling kinds of professions. And you can see that there's a range going from community health worker all the way to public health physician. There's just a broad range of these sort of helping professions. And with enterprising, you'll see a lot of the program management or supervision, some of the senior executive roles in public health, operations, logistics, quality improvement, and so forth. A lot of these also have either social or sometimes artistic as another element. And so if you like management, that can be another really great way to go. And then finally, with conventional, you do have roles in public health that have to do with, again, accuracy and compliance and things of that nature. So if you really love that type of keeping things organized and focused, there's a lot of roles like that in public health also. So you can see there's just such a diversity of things you can do with your degree in public health or in the field. Here's just one more image that I want to share about how do you potentially figure out how to prioritize your public health career. So I like to use Venn diagram images a lot because, you know, I know they're popular with my students who've studied statistics, but I also just like the imagery. So for most students that I work with that are interested in public health, you will see that there's sort of several things that are important and that comprise kind of your ideal dream job. Ideally, you get all of the things, you get this little overlapping area. And that includes the mission. And so in public health, many people are really, really passionate about public service and helping others and obviously improving the health of the public. And so they're passionate about a particular public health issue, whether that might be health equity, it might be a specific disease, it might be more a broad topic, it might be a particular population that you're interested to work with. And then secondly, you may be more motivated by the skills that you get to use. Some people are very open to different missions, but what they're really passionate about is using their favorite skills, whether those might be, again, you know, statistical analysis or writing or community outreach and so forth. So reflecting on your favorite skills is a step in the process of figuring out what you'd like to do in public health. You may find that there's certain tasks when you think back on jobs, internships, volunteering, even courses that you've taken in school, where, you know, there might be certain types of work that you've done where you loved it so much you could just kind of keep going all day long. And then there might be other types of tasks where you find that you are procrastinating because you'd really rather avoid doing those kind of tasks. So start to keep a list or a journal. What is it that you love to do? What is it that you're not that excited to do? And that will help you figure out what to do in your career in public health. And then finally, and I don't want to understate this. This is a very important element also, is the lifestyle and values. And that includes how much money do you get paid? What kind of work-life balance do you have? Do you feel included in the organizational culture? You know, you're probably also looking at a job in a particular geographic location and so forth. So these are all the other elements that come along with any job, including a public health job. So now that we have some food for thought about all the different possibilities in public health, I want to give you a couple of tidbits, and then I want to turn it over to our amazing panel of speakers. So a couple resources there. The first is the book 101 Plus Careers in Public Health, the 3rd edition. You're all welcome to use this discount to get a lower cost version of this book. The new edition just came out in October, and we really revamped I wouldn't say we rewrote the entire thing from scratch, but we really revamped the book. My co-author, who is the author of the first 2 editions, is a public health physician at the New York City Department of Health. And we rewrote this to include everything that has changed in public health because of COVID. We also included the new public health competencies and 10 essential public health services, all new information. We added multiple new occupations that really weren't included in the previous book. And we included pretty much almost all new interviews with really amazing people in the field. And I just want to say it is a testament to how incredible public health is, because these were folks that were being interviewed in the middle of the pandemic, and yet they took the time out to contribute to the book. So there's additional resources which haven't even yet been launched. So my hope is that when these launch, you'll be the first to know. So you can sign up on these different websites to get notified about these new resources. There's one focused on career development in public health. Another one is focused on public health careers specifically in government. And you'll see these elaborated on further. And now, of course, if you're a student, you might be excited to know that there's also some loan forgiveness and repayment programs. And these are especially relevant if you are looking at careers in local, state, tribal, territorial, federal government public health. Also, nonprofit organizations often qualify for some of these. So depending on what you're studying, you may qualify for certain of these loan repayment or forgiveness programs. So make sure you take a look. And again, these slides will be available after the session, so you can dig into this. And you'll see that some of these are very flexible, like public service loan forgiveness, and others are very specific based on what you're studying. And there's some brand new ones. The CDC has a brand new one, which is really exciting to see. Now, why are we talking about hot jobs in public health? Why are we talking about that right now? The reason why we're mostly talking about that is there's some pretty amazing things going on in public health. Basically, just yesterday, there was an announcement of $3 billion, $3 billion with a B, dollars to go to government public health departments. It hasn't even been fully sent out yet, to enhance the workforce, because we can tell that our public health workforce in government especially has kind of been underfunded and under a lot of stress for a long time. So now there's some resources to replenish that workforce. And some of the folks who are going to be speaking in a few minutes are really in the heart of some of these efforts. And so I just want to say that some of the fellowships and programs you're going to be hearing about in a second may be kind of fellowship programs, or they're term limited for a certain period of time. But if you happen to get into one of these special fellowship programs, make sure you find out how you could convert into a permanent hire. And so you would want to make sure you reach out to whoever you are working with, maybe HR, if you do get into these programs, to ask, how does the civil service hiring process work? Do I have to take a civil service exam? Is there a way for me to convert to permanent? How do I navigate the hiring process? Because especially in government, the hiring process can be quite different. You may have to do a certain different kind of resume. You might have to take exams. And so make sure you look into that, because my hope is that people stay in the public health workforce and we replenish it through the excitement of everybody here on the call today. So now I am really excited to turn over the floor to Lindsay Johnson, who is here representing our exciting new Public Health Americorps program. Lindsay, please feel free to take it away.
Thanks, Heather, and good morning, everyone. My name is Lindsay Johnson. I am an Eli Siegel Fellow at Americorps. I work closely with our senior advisor for COVID-19 on all things public health Americorps. So I'm really excited to be here today and share this opportunity with all of you. And actually, before I dive in, I just wanted to quickly note that I'm actually an Americorps alumni myself. Not that long ago, I served at a local health department in Oregon, and it really was a very formative experience for me in solidifying my interest in public health and public health knowledge base. So it's just been really exciting to be part of the development of this program that's going to be national in scope. Next slide, please, Heather. So Americorps works with local and national partners to tap the power of the American people to tackle our nation's most pressing challenges. We connect individuals and organizations, helping strengthen communities through people power and funding. Through our sponsor and grantee organizations, we provide thousands of opportunities to serve, including full-time, various part-time options, summer, and full year of service. There are opportunities to serve directly in communities with individuals in need and to work within a nonprofit to build capacity through indirect service. Americorps members and Americorps senior volunteers range in age, race, life experience, and more, and their goal for serving are also varied as well. We have many recent high school and college graduates looking for their first or next step in career exploration. We have mid-career professionals looking to make a change, and we have retirees looking for a way to give back, many of whom end up actually launching a second or third career as a result. Next slide, please. So Americorps has partnered with the Centers for Disease Control and Prevention, also known as the CDC, to create Public Health Americorps. This historic partnership really leverages the expertise of both of our agencies, capitalizing on Americorps' experience managing some of the most prominent public service and workforce development programs in the nation, while benefiting from CDC's technical expertise as the country's leading public health agency. The program will recruit and build a new workforce ready to respond to the nation's public health needs. It represents a $400 million investment of the CDC's American Rescue Plan funding, and we have a goal of recruiting up to 5,000 Americorps members in 4 years. So Public Health Americorps really has two overarching goals. The first is to help meet the public health needs of local communities by providing needed capacity and support in state and local public health settings, and advancing more equitable health outcomes for communities who are currently or historically underserved. The second goal is to provide pathways to good quality public health related careers by providing exposure through on-site experience, training, and more, with a focus on recruiting Americorps members who reflect the communities in which they will serve. As we all know, the COVID-19 pandemic has exacerbated many of the existing challenges in our country. It has also really highlighted the need for more people to pursue careers in public health. We believe that Public Health Americorps provides a really valuable opportunity to engage new communities and individuals in public health, exposing them to the diverse range of public health careers that exist. This program will also be one part of helping to develop a robust and diverse workforce to face the public health challenges of the future. Next slide, please, Heather. So as I mentioned earlier, adults of all ages and education backgrounds are eligible to serve in Americorps, and we have kept that broad eligibility for Public Health Americorps as well. And while we have a diverse core, we're working hard to increase the diversity of our members and our focus on recruiting Americorps members with a range of lived experiences and who come from the communities in which they will serve. So for example, a Public Health Americorps member could be someone like many of you who have studied public health at the undergraduate or graduate level, someone who maybe has some contact tracing experience and baseline knowledge of public health, but maybe doesn't see a clear next career step or experience without further education. But we're also looking to have folks who are newer to public health. So there's really a lot of options here. Grantees will be announced this spring, and then they will begin recruiting for this opportunity shortly thereafter. And there will be opportunities all over the country. And these roles can really provide a stepping stone into permanent jobs in the public health field. Additionally, you can see on the right some of the benefits of service. As part of the national training mentioned on this slide, we are partnering with the CDC to provide enhanced public health training and guidance and support on career pathways. And this is in addition to the on-site training Public Health Americorps members will receive from their host site. CDC and Americorps believe that Public Health Americorps provides a unique way to expose those interested in learning more about public health and its various careers. We are really excited about this historic partnership, and thank you so much for your time. Please visit our website to stay updated as more information becomes available. And if you have any questions or comments or want to make sure you're on our listserv, you can reach me at publichealth@americorps.gov. Thank you all so much.
Thank you so much, Lindsay. And now I am excited to introduce Dr. Christine Bean from the Association of Public Health Laboratories.
Thank you, Heather. I'm very happy to be here today to talk about opportunities in public health science and laboratory positions. I am the Chief Learning Officer at the Association of Public Health Laboratories. And prior to being in this position, I was in the state of New Hampshire Public Health Laboratory for a number of years. And I also have experience in clinical laboratories. So this is a very exciting time to consider a career in public health laboratory science. The COVID-19 response has really, truly highlighted the role that public health laboratories play in this country. Next slide, please. The mission of public health laboratories is on this slide. And what I'd like to talk a little bit about is the role that public health laboratories play, which is really focusing on population health versus individual health care. So in a public health laboratory, some of the examples I'll be talking about today include surveillance, disease detection, as well as environmental monitoring for water contamination, food contamination, and a new part of environmental monitoring is wastewater contamination and assessing wastewater for COVID-19 to really take a look at community exposure to COVID without having to go to individuals for testing. So the mission of public health laboratories is to really be looking at that community and at the population health. Next slide, please. So some public health laboratory science disciplines that I'll talk a little bit about and showcase here with some examples include disease diagnosis, which is really what we're probably best known for. If we think about our role in a public health laboratory in the COVID-19 response, when the initial testing became available from CDC, these tests are rolled out to states where a state public health laboratory will implement that new methodology and begin the testing for emerging pathogens that come out. The same happened in Ebola. And this is typical, the life cycle of a test is where the states would begin this work, validate that the test methods are working, before eventually these would become available to large reference labs and clinical testing labs in hospitals. So COVID-19 and the outbreak response is what we're very highly known for. Surveillance is a large part of what public health laboratories do. So as I said, looking at population health, and newborn screening is one example of that. So all newborns in this country are screened for inheritable disorders within X number of hours of their birth. Samples are taken from that baby before they leave the hospital to go home. And they're sent to, in many cases, public health laboratories in states where that newborn screening is performed in order to detect an inheritable disease and have that infant begin to have treatment before there would be any ramifications of that. Another example of surveillance is vector-borne surveillance. So a large part of what public health laboratories do is to do surveillance for arboviral diseases like EEE, West Nile virus, and examples of those vectors may vary depending on the geographic region in the country. And the goal is so that when those viruses are detected in the vector, messaging can be sent out to communities so that people could really take precautions and limit their exposures to those vectors if they're in the community. An example in New Hampshire would be, we have EEE every summer that's found here. And when we find that in communities, what might happen is Little League games or baseball games in the evening are changed into afternoon games. So the vectors exposure are limited in those evening hours. Environmental testing and environmental monitoring is another example of what public health laboratories do. Water surveillance, so water testing, food testing, animal testing, such as looking at animals for the possibility that they're harboring rabies virus. And biomonitoring is another example where some states are funded by CDC to perform measurements of chemical exposures in people in specific communities. In New Hampshire, for example, we have over half of our population served by wells, private wells. So we really do a lot of work communicating to our residents the importance of testing their well water for contaminants. Mainly arsenic is a significant problem here. And then part of our biomonitoring studies are that we also assess people for the level of arsenic and types of arsenic that they could have in their bodies. Lastly, for emergency preparedness and response is a large part of what the public health laboratories are responsible for, using test methods, equipment, and having funding from CDC so that each state in the country has the ability to respond to a chemical event or a bioterrorism event. Some of these methods have been used if there's weather events and there's chemical contamination, and really tracking for the possibility of bioterrorism agents. One other environmental surveillance I'd like to mention too is radiological surveillance. So many laboratories have the ability to monitor for radiation that could be contaminating the environment from sources of exposure, such as nuclear power plants in their community. Next slide, please. So we at APHL, working with CDC, have benefited from the American Rescue Plan funding, where we have expanded fellowships. And this expansion of fellowships will be over the next 5 years. So it's for a significant time period. And these are paid fellowship experiences where people with degrees, and you can see examples here, different degree types, whether it's bachelor level, master level, or PhD level, fellow candidates could apply to join a fellowship, which would be for roughly a 1 to 2 year period in any of these tracks you see across the top of the chart. We're very, very happy to have this funding to expand these fellowships. And the goal is to really increase the workforce pipeline. So we get graduates with interest in science coming into public health laboratories for a fellowship experience. And as Heather mentioned, with the goal that we would be interested in keeping people and having them stay in public health careers. So we really are hopeful that you're interested and would watch our APHL website for these fellowships. Our next step is that we're creating internship opportunities, and we expect those to be available later this summer. Next slide, please. So I'm very happy to be here today. I know we're going to take questions at the end, and I'll be happy to. I just thought I would give these 2 references for contacts for the APHL fellowship contacts, and there's also a good another reference for laboratory science careers. Thank you very much.
Thank you so much, Dr. Bean. That was fabulous. And now it's my pleasure to ask Joanne Pearsall from the Association of State and Territorial Health Officials to come and speak to us.
Thank you, Heather, and good morning or afternoon, everyone. As Heather said, my name is Joanne Pearsall. I am presently the Workforce Development Director at the Association of State and Territorial Health Officials. My background includes the beginning of my public health career as a health educator at a local governmental public health agency. I moved from there to the state health department. And after that, I went to an academic institution where I was the associate director of the Center for Public Health Practice at Ohio State University. After that, I went back to the state where I was on the leadership team and served as a deputy director, and I oversaw the Office of Performance and Innovation. And I joined ASTO last year, about exactly a year ago this month. And I share that with you because I'm watching the questions come in, and I know some of you have had questions that relate to different types of careers or position titles, or even what a health educator does. And I just wanted to share that with you, thinking that it might be helpful to you. So just a word about ASTO. The Association of State and Territorial Health Officials is a membership organization. Our members are the state and territorial health officials in 59 states and territories. We provide support to leadership teams in those organizations through training, onboarding, education, policy briefs, research, and advocacy. And there are about 200 employees at ASTO. We have many activities aimed at developing the workforce. I'm going to highlight just 2 of them for you today, but I encourage you to check out ASTO's website and learn a little bit more about what we do relative to workforce development. Next slide, please, Heather. So our Public Health Equity Corps is one of a couple of fellowship programs that this one is actually new to ASTO, started since my coming here a year ago. It is funded through the Kellogg Foundation to support equitable COVID-19 vaccine distribution. It's a 2-year paid experience. We have 8 fellows placed in 8 states currently, and I will say that since this slide was created, one of our fellows was actually hired by the state health agency where they were placed, and so we're looking to fill another position in a different state to take up that 8th spot. As I said, this is a paid full-time fellowship for 2 years, focusing on COVID-19. We do have a partner in this endeavor. Our partner is Lead for America. They are a nonprofit organization supported by Americorps in part and other philanthropic entities. They support fellowships. This was our first venture into a public health and equity focused fellowship, but they do fellowships across the country as a regular course of their business. All fellows do have a connection to their placement site, whether they were, that's their hometown and they're going back there after college, or whether it is their college town and they want to stay within that state. Lead for America's intention is to create those homegrown leaders that then focus on in leadership positions within those communities and focus on developing those states and or cities where they're placed for their experience. Next slide, please. So this slide highlights some of the work that those fellows are doing. They're about 6 months into their experience now. We have one fellow who is immersed in the mobile vaccine efforts. So she is arranging those vaccine sites, making sure that their vehicle is available, doing a lot of scheduling and partnership development within the community. We have another fellow that's conducting a literature review for health equity resources for their department. Several fellows are doing training for their staffs in their assigned agencies. They're doing a lot of writing, whether it's writing of RFPs, writing of reports or plans. Some are immersed in administrative processes to support their vaccine equity work, doing a lot of community work with stakeholders and community members. And one fellow is particularly focused on data analysis. While this experience was not uniquely available to public health students, we did get some fellows that had that type of experience. This, I think, goes to illustrate Heather's point earlier about careers in public health that are available to not only MPH public health students, but others outside of that arena as well. We do have many students, many fellows that are interested, have an interest in public health and will choose to go on in their career in public health, whether it's through additional education or through that career. Well, next slide, please. The last thing I wanted to share with you, and I don't mean to be a tease about this, but this is something that we're pretty excited about that is up and coming, and that is a public health careers site. We have received some funding to establish a devoted site focusing on public health to not only share what the various careers are in public health and what a day in the life might be for those careers, but also to link potential applicants for open positions within the field. We're starting with a focus on governmental public health careers and governmental public health jobs. We are expecting that to be open or launched within the next few months. And I encourage you to stay abreast of that launch. You can see on the slide the website for staying in touch that will be announced when it becomes live here within the next couple of months. Back to you, Heather. Thank you.
Thank you so much, Joanne. And now, last but not least, I am pleased to turn over the floor to Dr. Wences Arvelo from the CDC.
Great, thank you so much, Heather. And I'm an epidemiologist with the CDC, and it's really my pleasure to be here this morning or afternoon to talk to you about some fellowship and training opportunities at the CDC that might be of interest to many of you. Next slide, please. So just before I kind of start and talking a little bit more about the fellowship opportunities, I wanted to talk how the fellowships work at CDC. And pretty much every fellowship at the CDC follows a training through service model. And in this model, our fellows basically learn through a combination of didactic and experiential on-the-job training, with most of the training really happening on the experiential side. So basically, as a fellow, you could be placed at CDC or at a state or local health department where you'll be supervised and mentored by experts as you go ahead and conduct your investigations or analyze your data or provide your recommendations. And in this way, you'll be not only training, but while you're training, you'll be simultaneously serving and protecting the health of the public. Next slide. So I want to make sure people are aware that we do have a website that has pretty much all the fellowships that are offered by CDC. And I want to make sure people know about the site and potentially visit this website to get more information about the various fellowships being offered. It's a great resource. The website is very up to date, and it organizes all the short-term internships and full-time 1 to 2 year fellowships that are available at the CDC. And you could find all sorts of very detailed information about each of the training opportunities or fellowships from what you can do after the fellowship, what do you do during the fellowship, to what are the eligibility requirements, application instructions, and so on. So encourage you all to take a look if you're interested in training opportunities at the CDC. Next slide, please. And I would like to just hone in for a little bit on a few fellowships that are actually offered by the division within my division at the CDC, and spend a little bit more time talking to you about this public health detective fellowships, just so that you get to know this one's a little bit better. So the first one here on the list is the epidemic elective program, and this is a training program that trains medical and veterinary students on the principles of epidemiology and outbreak investigation. So usually these students come in for 2 or 3 months, and they're placed somewhere at the CDC or at the local department, and they shadow experts as they doing their work. Sometimes epidemic intelligence officers, which is the next opportunity I want to talk to you all about. So that's the Epidemic Intelligence Service, the EIS, which is obviously one of our most well-known fellowship opportunities. It's a fellowship that trains physicians, veterinarians, doctoral scientists, and other health professionals, again, to do outbreak investigation, surveillance type of work, and so on. And we've been training people for over 70 years. It's again one of our probably our most well-known fellowships, but it's not the only fellowship that we have. So I do wanted to make sure that people know and understand that as you're kind of thinking about your career path, think about your background, think about your interest, and sort of make an informed decision of where you think your path could lead, and what fellowships will help you achieve that path in the best fashion. So EIS is a great path if you're thinking about being in epidemiology, working at the federal government in public health, or working in a state or local health department. But there's a number of other fellowships that we have, especially within our division. So the next one here is our Laboratory Leadership Service. So if you have more of a background in the laboratory sciences and you're more interested in sort of this science, laboratory science and leadership, then this will be a great fellowship to look into a little bit more. We also offer a preventive medicine residency. So this is for people that have already, they've gotten their medical degree, and they're potentially more interested in expanding their breadth of population health, digging a little bit more into policy and public health evaluations. And this will be a very ideal opportunity for them to follow. Next here, we have the Public Health Informatics Fellowship. And this is obviously, if you're more interested in working on the side of public health that deals with data and informatics, this should definitely be more in your interest lane. And next, we have the Prevention Effectiveness Fellowship. And this one is more for people that are into sort of the economics and sort of the quantitative side of policies and evaluations. So many people come and do this Prevention Effectiveness Fellowship with us. And finally, we also offer the Presidential Management Fellowship. So if you're more interested in pursuing sort of a management track at the government, particularly in leadership positions, this will be an ideal track for you. So many of these fellowships, when you go in and take a look, they're really targeting sort of career professionals or doctoral graduates, but many people start thinking about this career path as they undergo their master's degree or even earlier as an undergrad. So make sure you start taking a look at these fellowships and understanding what they are, what they could mean for your career path, so that you can start making some informed decisions about how to best get there. Next slide, please. So, and before I end, I would like to sort of close with this. I know it's a very busy looking slide, but as you can see here in the middle, we have the CDC director, Dr. Walensky, which I've sort of circled in red, and we sort of highlighted a number of leadership staff that support her and basically all in the management of all aspects of the agency. And these individuals that you can see here have completed one or more of our public health detective fellowships, as you can see by the fellowship logos next to their names. And this is not just among our CDC fellow leadership, but it's also the case for pretty much most of our public health practitioners working at every level within the CDC. And I just want to show how this is sort of highlighting how our fellowship programs really serve as a pipeline. So when we talk about a pipeline, we're saying, you know, we bring the fellows in, but we try to retain them so that they have they pursue a public health career, not only at the CDC, but also in state and local health departments and potentially internationally. So with that, I would like to end and pass it over to Heather. Thank you so much.
Well, thank you so much, everyone. I know we're getting to be close on the time, and we have so many incredible questions. I've been trying to answer them using my fastest typing skills. And so if those of you are interested and have time, we can keep this going a little bit longer past the hour if you'd like, to try to get to some of these questions. But, you know, just general tips, use your career center, keep an eye out for other special fellowships and internship programs. ASPPH has a list of these fellowships that are specific for ASPPH students also. And publichealthjobs.org is another great website for public health careers. And, you know, definitely know this has been recorded. You can get in touch with us for other questions. I'm putting my email there at the end here of the slides. But now I would love to just see if we can turn it over to the whole panel and try to answer at least a couple of these incredible questions. So everyone who was able to stay on, feel free to stay on. There's some very specific questions. A couple of them are about internships. And I know Dr. Arvelo mentioned internship programs. I was curious if anyone else on the panel wanted to share whether there's internships or other sources to look for those that you might want to share. In particular, maybe Dr. Bean or Joanne Farsal, if you have any other suggestions about internships.
I can start if you want, Heather. We are in the process of designing the internships for the public health laboratories, and these would be roughly 12 to 16 week internship experiences that could be done either in spring or fall semester or during the summer. We're trying to be very flexible. And once we have it opened up later this summer for interns to start in fall, these are paid internships. So our goal is we have this ready and up in summer for rolling or continuous applications for interested interns at that same APHL site. I would just go on the APHL website and look for what would be a fellowship and internship opportunities. So it's coming soon.
Yeah, Heather, I'll just add quickly to that. And unfortunately, there is not a central repository for internships relative to many opportunities that might be available in public health. They're generally focused on like job boards for specific entities or organizations. So I guess I would advise, look, if you're looking in a particular geographic area, look at governmental public health agencies that serve that geographic area. I know my association does hire interns periodically. That would be, you know, a couple of interns per year, and those are posted on our job board. If you're looking more broadly, I just echo what you said earlier, Heather, about staying in touch with your career services folks, because they may have other places that they could send you to look for internship opportunities. And I'm hopeful that the public health career site that we talked about earlier will eventually be a nice repository for those types of experiences.
Great. We got a whole bunch of questions about international students, and I just want to quickly say that I work with a ton of international students, mostly on the F1 visa. And generally speaking, I know most of the time in the federal government, it can be difficult to find opportunities that are for non-US citizens. I'm not sure if that's the case with Americorps also, but generally there's a ton of other opportunities that exist. I know this webinar focused a lot on our governmental public health workforce, and there are sometimes local health departments, depending on what they're needing to hire for, sometimes they can be open to international students, but generally I would look at nonprofit organizations and sometimes for-profit companies. There's just so many things you could do in public health. If you think of the slide that we showed earlier with like just a snapshot of some of the employers, I would just think broadly and, do a lot of networking. And again, like we keep saying, make sure you use your career center, make sure you use your international student services office if you're a student on the F1. So don't be sad that a lot of this particular program is focusing on the US citizens and so forth, but just know there's so many opportunities. And I noticed a few other people who are asking questions like, how do I get my foot in the door? What do I need to do to stand out? What kind of software should I learn to code in? And I would just say again, read the job descriptions for positions you're interested in and then work backwards from that. So if every job you see requires coding in R, guess what? Time to go learn how to code in R. I'm just using that as an example. And just know that there's just such a demand right now for people with skills in public health in such a diverse range of areas that if you're persistent, if you build your network with people in the field, and you look for a range of opportunities, there's something for you in public health. I don't know if others want to share just a couple words of wisdom for our students who are, having that moment of worry. How will I get my foot in the door? How am I going to get into this exciting career field? Whoever would like to share. Yes.
Yeah, so I'll go ahead and start because I think it's a great question. And again, I see that in the chat, people are asking like, what kind of experience do I need to have? And how do I get my foot in the door? It's definitely a big thing on students' minds. And really, like I was mentioning, fellowships are a pipeline to eventually get a job in public health. So I think if you are interested in public health, I would seriously look at one of these fellowships, whether it's an internship or a full-on, 1 or 2 years fellowship. They would increase you'll increase your skill set, but you'll also obviously make good connections, and you'll, eventually, get a job in that's going to fit your needs. So a fellowship is a really great way to sort of get started in a public health career. Over.
Yeah, Heather, the other thing that comes to mind, prompted by some of the chat questions, is don't limit yourself to thinking strictly in terms of what the job is called, because especially in governmental public health, jobs can be called very generic things. So you almost have to think about what else some position might be called, like a program coordinator or a program manager might be another way of saying a health educator, or a health educator's experience would apply to doing those functions. So I think just thinking broadly about what positions are called.
And just to add really quickly, that was actually one of the goals of the creation of Public Health Americorps, is to make the field of public health more accessible in that stage, really, where you're trying to get the foot in the door, if you will. There's a lot of opportunity for hands-on experience in a public health context while also making an impact. And so once grantees are announced, I definitely recommend checking out our website and learning about opportunities when they're available.
Great. We have a couple of very specific questions. I'm thinking potentially that folks may be able to respond individually afterwards. And, there were a couple of questions about, there's one question that what's the difference between public health labs and medical labs? That's a good one for Dr. Bean. Would you like to try for that one?
Sure. So medical labs in my definition of that is really like a diagnostic clinical laboratory. So these would be hospital laboratory, for example, where medical laboratory scientists would work. And those skills that people learn for those types of jobs can absolutely be crossing over to the public health laboratory. But the mission of each of these laboratories is what's different. The medical laboratory is diagnosing someone with a disease. So here's an example. Someone comes into the emergency room with chest pain, and they have blood taken for cardiac enzymes to see if they've truly had a heart attack. The person's admitted to the intensive care unit. The public health laboratory does not play a role in that. What public health plays a role in would be, how can we assist with the reduction of chronic diseases, right? And what role could we play? Maybe the public health laboratory is looking at, are there environmental exposures that add to the risk of someone for having cardiovascular disease? So we're really not diagnostic as much as medical labs are. We're more looking at root causes and trying to limit chronic diseases and look at environmental exposures.
I have a couple other questions from people who are making a career change, either a mid-career, they've had a previous career. Any advice for somebody who maybe has worked in another sector and they're just passionate about public health and want to join the field? Anyone who wants to share tips? I have some thoughts, but I basically, in my opinion, right, like a lot of this is translation. Translating your prior experience so that it's understandable to your future audience. So if you've worked in, it depends what you've done before, but you know, if you have worked in fundraising and grant writing and now you want to do program management, you've probably managed a program even if it was an event that was designed to raise money. So figuring out how you focus on the skills that translate to your future audience is really important. Sometimes when people make a career change, going back to school makes sense to get a new credential. Sometimes volunteering is a great way to build some more experience, or interning. I'm looking at Lindsay, Public Health Americorps is another great idea for career changers. And then building relationships and networking, doing informational interviews with people, finding alumni of every school you've ever attended, and just asking people for their guidance. But I don't know if others would like to share, like someone who might be mid-career or career changing. Do you have any suggestions?
Just to echo a little bit of what Heather just mentioned, the training opportunities of Public Health Americorps specifically allows you to get some more formalized, educational experience without necessarily going and getting a master's or another degree in public health. And other, contextual opportunities are also like learning opportunities in and of themselves. So it really does help kind of provide that bridge, if you will. But also, like Heather mentioned too, like so many things, like everything is public health to a certain extent. So it's really just about how you translate that.
I echo that, Heather. You said what I was going to say about making sure the lines are clearly drawn between your past experience and what you've done from a skill and function perspective to the public health arena.
I had a couple of questions for Dr. Arvelo, I believe, that had to do with field epidemiology. I don't know if you can share a little bit what that looks like. And also, do all the epidemiology jobs require you to know how to do coding? Is it all about coding, or are there others that are not as heavy on the coding and statistical analysis? And then similarly for Dr. Bean, are there roles in the public health labs for epidemiologists? So Dr. Arvelo, do you want to start out with field epi, and what does that look like? Oh, you have to unmute, sorry.
Yeah, this is thank you. That's a great question, and it's something that a lot of the fellowships obviously have a strong component of going out and conducting field work, collecting data. You have to go out, be part of a team, working on a team, working with partners. So you're going to have to learn all those skills in public health, and pretty much many of the fellowships that require that type of public health detective work are gonna want to expose our fellows into going out into the field and doing work with partners in state and local health departments, collecting data, and then coming back and analyzing those data and providing back recommendations. So a big portion of our work is going to be done in the field, and then another portion is going to be done back analyzing the data, which leads me to the answer to your second question. Do you need to know how to code to work as an epidemiologist? You don't necessarily need to become a code expert. You're going to have to, every epidemiologist is going to have to know some sort of, if you're talking about an epidemiologist, every epidemiologist is going to have to know some sort of fundamentals of statistics, and we usually teach those. But then you're going to have to work with experts. You're going to have to work with other statisticians, and this is sort of the core of public health, is that you're always going to be working in a team sort of environment, and you're going to be relying on people from multiple disciplines to help achieve a common goal. So this is the importance of bringing lab together with epi, with informaticians, bringing all of us together to solve a common problem.
Thank you. Go ahead.
Yeah, and as far as the epi and lab, so when I was in the public health laboratory as a director, many of the scientists I had who were interested in doing a master's degree, I would always recommend they consider an MPH to broaden their science background. And as Dr. Arvelo said, we're constantly working on teams, and there is a role for someone with epi knowledge and background in the laboratory for designing studies, for biomonitoring programs where you're looking at really going out into communities and developing programs where you're going to be collecting samples and doing studies. So yes, there is definitely a role for both together is ideal.
Wonderful. So we have like 85 more questions, but I don't want to take everyone. We could stay here for a year. I think this is just such a nice group. I did have one or two more questions that seem like they're a theme. So for some of these fellowships, one of the questions is, can you choose the geographic location that you would like to work in? I'm seeing nodding heads. I don't know if that's always the case. And also, are there benefits like health insurance and things like that?
So I'll start with CDC Fellowships, and again, go to the website, and every fellowship is going to be a little bit different. Some fellowships are strictly in geographical areas outside of Atlanta. Other fellowships, you will have to be in Atlanta. Other fellowships are going to require you to travel, or some fellowships don't. So it's going to be very dependent on each fellowship, but for the most part, if you're flexible, you should be able to find a fellowship that's going to fit your needs.
Yep. For the APHL fellowships, we currently have fellows from Alaska to Florida. They're all over. But if there are geographic restrictions or needs, a fellow can certainly voice that, and we try to make it work for them if they need to stay in a specific area in the country.
At least for Public Health Americorps, the locations will definitely depend on who the grantees end up being and on our host sites. So not to sound like a broken record, but definitely stay updated on our website for more information about that and benefits.
Well, thank you so much, everyone. I mean, honestly, we have so many wonderful questions. I just want to say, public health is kind of at I would say, a critical point right now where there's a huge need for people to come and join the field. And, I know today we focused a lot on what I, again, consider the backbone of the workforce, the governmental public health workforce. There's public health. I think it was Lindsay that you said public health is everywhere. Somebody said that. I don't know who said that just now, but public health is really everywhere. So one way or another, I know everybody here today will find their path to the right career in public health. And I just know that there are a lot of people out there rooting for you. If you're excited about the world of public health, there's a lot of people who are really passionate about this field. And we wish you all the best. Again, the slides I know and the recording will be sent out to everybody. after the event. And I just want to, again, thank all of our wonderful panelists. I'd like to thank Nick Mahoney from ASPPH for organizing this. I'd like to thank each of the panelists, Lindsay, Joanne, Christine, Wences. Thank you so much all for your time and your energy being here today. And definitely stay in touch, and we wish you all the best of luck in pursuing your public health career. Thanks, everyone.